So thank you so much, everyone, for being here this afternoon. We appreciate you taking the time out of your day to join our presentation. My name is Kayla Rogers, and I'm an Education and Outreach Coordinator for the Women's Fund. For those of you who are not familiar with the Women's Fund, we are a not-for-profit organization in Houston, and our mission is to provide women and girls with the tools they need to be advocates for their health. We do this through focused seminars like today's presentation, as well as curriculum-based classes and publications. Our programs, presentations, and publications are completely free. If you haven't ever visited our website, thewomensfund.org, I highly encourage you to take a look at it. You can see upcoming events that we have and also order publications, physical copies, or you can download PDF versions. So today we have a presentation for our mental health awareness series over depression and stress with Dr. Byron Patel. So I'm going to do an introduction and then I will turn the floor over to him. So Dr. Patel earned his medical degree in 2013 at Texas Tech University Health Sciences Center, School of Medicine in Lubbock, Texas. He completed his psychiatry internship and residency at the University of Texas Health Science Center at San Antonio in 2016. He completed a child and adolescent psychiatry fellowship at the University of Texas Medical Branch at Galveston in 2018, and an addiction psychiatry fellowship at Baylor College of Medicine in Houston in 2019. During his fellowships, he cared for patients at Ben Taub Hospital, the Michael E. DeBakey VA Medical Center, DeVreux Residential Treatment Center, JSA Health Telepsychiatry, the University of Texas Medical Branch at Galveston, and the University of Texas Health Science Center at San Antonio. Dr. Patel joined Kelsey-Seybold Clinic in 2019 and is the managing physician of behavioral health. While in his most recent fellowship in addiction psychiatry, he furthered his knowledge in academic medicine, psychotherapy, and the ability to publish peer-reviewed articles. Current endeavors include establishing the behavioral health department at an accountable care organization, Kelsey-Seybold, and working with the medical professionals within a collaborative care model. Dr. Patel is a member of the American Association of Addiction Psychiatry, the American Association of Child and Adolescent Psychiatry, the American Psychiatric Association, and the Texas Society of Psychiatric Physicians. He enjoys exercising, sports, auto mechanics, and spending time with his wife and 2 dogs. So that was very, very impressive bio. Before we get started, I do just want to go over a few housekeeping issues. If you could keep yourself on mute throughout the presentation so that we can limit any distractions, and also utilize the chat. If you have any questions during the presentation, we will have a session at the end to answer any questions that you might have. But other than that, I'm going to go ahead and turn the floor over to Dr. Patel.
Very good. Thank you for having me today. I appreciate y'all's time, and we'll be talking today about depression and stress. And so, very good. So when we're talking about depression and stress, I guess I'll say next slide, Kayla, to go to the next one. Okay, that's just my bio. And the next slide. So we'll start off by defining stress. Stress, what is it? Stress is the body's autonomic response to any physical or mental demands placed on it. There can be different types of stress. So for example, acute stress is ones that happen randomly and can cause a lot of stress. For example, getting a flat tire on the way to work, or a traffic jam, or running late for a flight. These are acute things that typically you don't really plan for, but they can cause a lot of feelings of stress and feeling uneasy. The next could be episodic stress. So this could be stressful events that occur regularly. For example, hosting like a Thanksgiving dinner for 100 family members, or planning events. Sometimes there can be something every year that happens at the same time, and it can definitely trigger stress. And then chronic stress. So what this is stressful events that are constant with no end in sight. And I'm sure all of us have experienced some form of maybe acute, episodic, or chronic within this last 14 months with the pandemic, as there's no end date on the pandemic. When it first started, there was no real target end date or period that it would end. So that could be an example of chronic stress. Next slide. So the stress response. Whenever we feel stressed, it triggers this phenomenon called fight or flight. So in a life-threatening situation, the stress response is a good thing. It could help you survive. Unfortunately, your body experiences this stress response to all stressful events, regardless of the severity. So over time, this can be harmful to your health. So for example, whenever you're under stress, your heart rate can go up, you can start to get sweaty, you can start breathing faster, your eyes can dilate. So it's kind of like your body is prepping itself for fight or flight. We have this example we call the paper tiger, although now in Houston, maybe they can be an actual tiger. But what the paper tiger means is, if you imagine being in a room with a tiger or a lion, you would start to feel uneasy, your stomach might hurt, the heart rate would go up, you might get shaky. So in anxiety, it's like you're in that room with the lion or the tiger, but it's not there. But your body is still developing that same response and kind of that conditioned response that it's a fight or flight situation. Next slide. So stress and your health. Long-term stress can disrupt several different body systems and put you at risk for different health problems, including depression, digestive issues, heart disease, memory impairments, obesity, recurring infections, skin conditions such as eczema and dandruff, as well as sleep disorders. So I like to use the example, stress can kind of overload your mind, and then it kind of spills over into different body systems. So for some, it could be heart rate goes up, high blood pressure. For others, headaches, migraines, muscle aches, body aches. Stress can definitely spill over into different body systems. Next slide. So now we will talk about kind of identifying stressors. All of us are different. Everyone has different stressors. So some external factors can be your environment. If you're in a place that's really loud, chaotic, lots of change, unrest, that can kind of be a trigger. Family. I'm sure we've all had family members, we love to see and feel calm with. And then maybe you have a family member that just makes you feel a little on edge, uncomfortable. And my audio is still okay?
Yes, it is still okay.
Just checking. I heard something. Just wanted to make sure. So other external factors can be life stressors or life changes, both positive and negative. So for example, positive ones, going on a job interview, moving to a new city for education or work, first date, getting married. There's certain stressors that can still be a positive stress, but then there can also be, major life changes that cause a lot of negative stress. So that's like loss of a loved one, not sleeping, not eating. And we'll go through some more later in the presentation. Social life and relationships, those can be stressors as well, especially, if there's any sort of friend or, criticisms, things like that. Unpredictable events, which we talked about, the acute stressors earlier, and then work and school, those can be stressors as well. So these are external stressors. Now we will talk about internal stressors. Next slide. So some internal stressors can include whenever our minds experience different situations, different environments. Sometimes our minds can do this thing called cognitive dissonance. What this is it's kind of like experiencing an event and then interpreting it in a way that kind of sets ourselves up for more stress. So one example for this is catastrophizing. Let's say you're running late for a flight and you feel, okay, I'm running 5 minutes late, so I'm going to miss the flight, and so my family's not going to see me, and so I'm going to have no more family or friends. Even though it's 5 minutes you're running late, the mind kind of took it and ran. And so that's called catastrophizing, but sometimes our minds can do that. Fear or phobias can be another stressor that our minds can do. Personal beliefs. So this can be depending on how you feel, your upbringing, modeling off of your parents or respected adults growing up that can affect your personal beliefs. And then also uncertainty and change. Sometimes change can be very uncomfortable, can drive progress, but for a lot of times it can be, some discomfort can cause stress as well. So next slide. So now we'll talk about depression. What is it? Depression is actually the term we know it as major depressive disorder. It's a period for about 2 weeks where you have to have at least 5 of these symptoms. So if you've noticed changes in your weight and appetite, that's either stress eating or not eating at all and losing a significant amount of weight. A depressed mood, more days than not over 2 weeks. Having either insomnia, which is not being able to sleep, or hypersomnia, which is sleeping too much. Loss of interest or pleasure in most activities. That means giving up your family, your friends, your hobbies, could be isolating. Low energy, not having energy to do things even at home, chores, those kinds of things. Poor concentration, decreasing performance at work or home. Psychomotor retardation or agitation, that's like feeling more restless or feeling more slow when doing things. And then recurrent thoughts of death or suicide. For any thoughts of death or suicide, I would definitely recommend that if it's for yourself or a loved one, getting help as soon as possible. The reason being is with suicidality, we wouldn't want to put it off or wait for a couple months or weeks. Definitely reach out to either the primary care doctor, psychiatrist, emergency room, trusted professional. And then the last symptom can be thoughts of worthlessness or guilt. So major depressive disorder, you would have to have about 5 of those. You'd have to have 5 symptoms for 2 weeks. Next slide. So some facts about depression. Depression does affect more than 16.1 million adults in the US, or about 6.7% of the population. The median age, which means if we lined up all the population and the age in the middle of the data set, would be about 32.5 years. So some can have depression before and some can even have it later, but about 32 and a half. It is more prevalent in women than in men. And depression is an illness and warrants treatment. We like to tell everyone that if someone had diabetes or high blood pressure, we wouldn't kind of say, oh, they're taking insulin or, you're taking antihypertensives. But yet within psychiatry and for depression, sometimes it's like, oh, you're seeing a counselor or you're taking antidepressants. But we're trying to work to, reduce that and to make it just like, the mind is an organ system, just like any other part of the body. Depression can affect how you feel, think, and behave. No one chooses to be depressed, and depressed people are not weak or crazy. So depression is a medical condition, and there's a lot of treatments for it. Next slide. So mental health in the workplace. Depression is the leading cause of disability worldwide, according to the World Health Organization. So it actually has the highest rate of, disability in life year days. So it's a term that the WHO uses, but employees can, feel stressed and anxious trying to balance work, friends, and family while navigating careers. And then early identification and treatment saves and improves lives, while reducing associated healthcare and disability costs. So depression, just like any other medical condition, if we treat it earlier, it's usually easier and, you can really change the trajectory rather than if you wait for it to grow and get worse. Next slide. So within the workplace, about 30% of the US workforce reported having depression. About 44% of lost work time was reported for employees with depression compared to employees without depression who filed short-term disability claims. 70% of those who have had depression were not currently receiving treatment. And 97% of employees who reported having depression also reported having other medical conditions. So this goes back into depression not only can affect, your mood, but maybe how you do with your diabetes or your high blood pressure or exercise. So depression can definitely have its hand in a lot of other things as well. So next slide. Ways to find help. There are several different ways we can find help. One of them, a good place to start would be to talk to your doctor, who would be able to provide treatment or refer you to a specialist. The majority of antidepressants are actually prescribed by primary care providers and not psychiatrists. So just based on the sheer availability of primary care doctors out there, and primary care doctors have experience with depression and anxiety and treating it, that would be a good place to start. If a psychiatrist is needed, your primary care doctor would be able to refer you to a specialist. The second option you could do is connect with a mental health professional. You could check with your insurance company. On the back of the insurance card, they might have a behavioral health plan, a BH plan. Some examples could include Optum Behavioral Health, United Behavioral Health, but checking with your insurance card about the behavioral health carrier. If you don't have health insurance, I would recommend contacting your community mental health center. The one for Harris County is called Harris Center. They used to be called MHMRAs, but they've changed the name now. But almost every county in the United States has some sort of public health department that can help with psychiatric care. Another option you can do is build a solid team with select friends and family who will support your efforts in finding help. So this is speaking to that trusted family member, trusted adult, who you can let them know that, I think I might be feeling this way, or my work performance, home performance is suffering. What should I do? And, kind of getting help with your support network. For some, it can even be faith-based mentors. So if you have like a spiritual leader or someone you're doing counseling with, you could always ask them if you need more help as well. And then the fourth option could be finding a local support group. Many hospitals and community centers host support groups. In the city of Houston, there is the National Alliance for Mental Illness, or NAMI. Also, Remind Houston is another one. These are support groups for people and their family members who have had depression or anxiety or mental health conditions. So there's community resources as well. Next slide. So now coming to treating depression, there's several different options for treating depression. Some involve medication, some do not involve medication. So one that doesn't involve medication is called psychotherapy or counseling. Medical insurance companies oftentimes cover this. You could call the back of the card to find a covered provider. Some human resource departments have it through the employee assistance programs. So that's another avenue to check in. I know now with this last 14 months, a lot of companies have been emailing their employees about if they need to speak to someone or touch base with their EAP advisor. That's an option some companies are offering as well. Other treatment options include antidepressants. So what antidepressants do is they help to modulate our neurotransmitters in the brain, more specifically serotonin and sometimes norepinephrine. And they do take about 4 to 6 weeks to be effective. The reason being is, although it increases the amount of serotonin or norepinephrine in the brain, it takes about 4 to 6 weeks for the receptors to become downregulated, which pretty much means they become more sensitive to the serotonin that's there. Side effects can lessen with time. A lot of times, sometimes it could be a stomach upset, diarrhea, just different, side effects that can occur. But your doctor should review those with you before prescribing the medication. And they should be taken for at least 6 months. So a question we get a lot of times is, how often do I need to take this medicine? Once the depression or the anxiety improves, after about 6 months, the doctor can work with you. If you're feeling great and have a good support system, counseling, there's ways to kind of wean from the medication, but I would speak with your doctor about that. Next slide. So helping loved ones with depression, whenever you have a family member, friend who you feel may be having depression or anxiety or any symptoms like that, do offer support where you can listen to them, offer to spend quality time with them. And then do get help if you think they're at risk of harming themselves or others. So if someone's been talking about wanting to end their life, giving away their possessions, collecting knives or guns, anything like that, definitely call their primary doctor, emergency room, even the ambulance, 911, because we would rather a trained professional see them and treat them than them have the depression by themselves. Don't try to tell a depressed patient to cheer up or kind of snap out of it. It doesn't work like that. It's a medical condition, and so it takes time to treat. And don't try to assume that a depressed person is just looking for attention. A lot of times when you are feeling depressed, a lot of times you're not looking for the attention. So whenever you do say how you're feeling, it's very limited. The depressed person may not open up to everyone. So definitely listen to them and help them out. Next slide. So there is the National Suicide Prevention Lifeline. It's a 1-800 number, 24 hours a day. You can also chat online at suicidepreventionlifeline.org. So it's a good resource for yourself or also for family members, loved ones, in case anyone needs. So now we'll go to the next slide, coping techniques. So coping techniques, there's several different things that can help you feel better, don't involve medications. And so one of them is social support. Strong social support system can help relieve stress and decrease negative effects on the body. So this includes building and strengthening your relationships with your partner, friends, family, and coworkers. You can also consider joining a support group to expand your circle of friends. And so this is where, as the pandemic hopefully is coming to an end, you're able to kind of start seeing people again, in small groups or vaccinated groups. So you can start to expand again on your social supports and your social circles. Next slide. So exercise is another good one. Exercise is good for your health in general, and it's a great way to relieve stress. When you exercise, there's these endorphins that are released. And what they do is they can boost your mood and help to take your mind off of stressful situations. Regular exercise can also lower symptoms associated with depression and anxiety and can improve sleep. And so people have asked for myself, with pandemic working, how do you help with stress? There's popular fitness bike that I've been using, but so many different, exercise routines, whether it be just a walk in the park, dogs, exercising with them, or family members, friends, just doing some activity may help with relieving the stress and also helping your mood feel better and reducing anxiety. Next slide. Time management. So time management, we all have tasks to do. So making a list of tasks that you need to complete can be helpful as well. Prioritizing tasks based on how important and urgent they are, and planning chores and errands ahead of time. So this is Eisenhower decision matrix, and some examples can include, let's say something's important and urgent, like you have a project due at the end of the week for your work. You would do it now. That's something you can't really put off for too long, since your work, your livelihood. Something that's important but not urgent, which is decide, is let's say you have a child who needs crayons or some materials for a project at the end of the month. So it's important that he gets his supplies or she gets her supplies, but you may not have to do it today. So definitely it's important, but it's not urgent. Something that's urgent and not important, which delegation comes into play here, is like chores. So for example, let's say you have household chores. Are the children old enough to help? Could you, delegate to someone to help clean or to get food from outside, catering or something to go? So household chores can be an example of things that sometimes can be delegated. And then the last one is delete. So something that's not important or not urgent. Example they use with social media, but I know sometimes with the news cycle, social media, you can really spend a lot of time doing those activities, but it may not fall into the same category as the other three. So just something to be mindful of. Next slide. So asking for help. Speaking with a physician or therapist, trained professionals, they can help to manage your response to stressful life events. So most health insurance plans offer mental health coverage. Your mental health is just as important as your physical health. So definitely let your primary care providers know, or counselors, therapists, whether it be work, schools have counseling as well for children and adolescents. And then colleges sometimes have student health centers where they'll have trained physicians and therapists. Next slide. So develop soothing habits and behaviors. So some things that can be soothing is put down your phone. We have this thing we call screen time, and sometimes with work, you're on the computer, then you go home, watch TV, phone. Sometimes the screen time can be there a large part of the day. But putting down your phone and trying to work on some of these other things could help with relieving your stress. So playing with your pet. Pets have been shown to help with mild anxiety and depressive symptoms, as well as stress. So spending time with pets. Gardening, and to an extent nature, being out in nature, greenery, kind of can help to relieve stress as well. Stretching or going for a walk. So one example is yoga. Yoga is very beneficial for stress, as well as there's some studies coming out for mild anxiety and depression. So yoga can be a form of exercise and stretching. Listening to music, engaging your brain with a puzzle or Sudoku, or even trying adult coloring books could be something creative. If you're a scrapbooker, cross stitch, quilting, photography, just something more on the creative side. And then starting a gratitude journal. So we have a term, where we use this affirmations. It's kind of positive things you write about yourself, whether you're funny or you're well educated or you're, a really good cook, but definitely, start to kind of write those things that, you're grateful for, not just for yourself, but also with others. So next slide. The 4 A's. So what the 4 A's is this is another form of kind of time management. We can use it with stressful situations. So the example we'll use is, let's say, traffic. There's a photo of traffic. So first A will be avoid. Is there a way we can avoid stressful situations altogether? So maybe changing your route that you go on, or changing the time that you go and come to avoid traffic. Second one is altering. Can you change the stressful situation? So example could be using public transit instead of driving. So using a bus or a train, and then that way you don't have that stop and go or that stress. Adapt. Adapt is the third one. Can you adapt your mindset so you no longer find the situation stressful? This could be using the time in traffic to listen to podcasts, audiobooks, or talking hands-free on the phone with loved ones. So it's kind of even though you're in that traffic, you're still catching up with others, or learning about something new with the podcast. And then the fourth A would be accept. So can you accept the stressful situation for what it is and move forward? So realizing the traffic will always be a part of community, and developing coping mechanisms to practice while you're sitting in traffic. So this is just the example of the 4 A's with an example such as driving in traffic. Next slide. So mindfulness. Mindfulness is paying attention on purpose and without judgment. We can be mindful of our senses, emotions, and inner thoughts. So mindfulness, it's kind of like hitting the pause button when you're there and kind of dissecting all the different things that are going on at the same time, and just being aware. So it's not about zoning out or avoiding anxiety or avoiding depression, but it's more about recognizing the way you feel and the way that you're thinking. Next slide. So the way mindfulness works is there's a process. A lot of times starts with meditation or deep breathing. So we work on focusing our attention. So to be mindful, you focus on anything you choose. One example we use is deep breathing, so your breath. So when you're taking a deep breath in through the nose, holding, and out through the mouth, you try to do just that. You might notice the mind goes to bills or the children or making dinner or something, driving. It could be so many different things. And during the process of mindful, the deep breathing meditation, you're trying to just reset on your breath. And this is something that with practice gets better the longer you do it. So it doesn't work, the first day, but it takes some time, some practice, a little bit every day. Next one is staying present. So staying present is being in the here and now, and being aware of the way things are right now. Your experience is valid and correct just as it is. So we have a term for this, living in the moment. Sometimes our minds want to go ahead 5 days and say, I got, 5 days worth of projects, or it goes in the past and says, I should have, could have, would have. So mindfulness works on being in the present, the here and now today. Being non-reactive, this is where when you experience something, a lot of times we automatically react to that experience based on past conditioning. So we say instead of having a reaction, we want a response. What a response is you're able to see the situation without any judgment or analysis. So if something happens at work or home, rather than immediately reacting, kind of you have a little bit more of that time to examine, okay, this is what's happening, this is how I'm feeling, and this should be the best answer. And then experience versus thoughts. So mindfulness encourages us to respond to our experience rather than reacting to our thoughts. A reaction is automatic and gives us no choice, whereas a response is a deliberate and considered action. So that's how mindfulness helps us to split the experience and thoughts. Okay, next slide. So one of the building blocks of mindfulness is meditation. Meditation can involve two different forms. One is called informal meditation. Informal is like what, for example, when you focus your mind on a specific activity, such as brushing your teeth, cooking, or cleaning. So when you're brushing in the morning, cooking, taking a walk, you can work on your steps or you work on your breathing. That would be more of an informal meditation. Formal meditation is when you take time out of your day to complete a meditation practice. So this can include things like a body scan meditation, focusing on your breath, yoga. And so there's several smart apps. You may have seen some of the advertisements, but there's several smart apps which talk about meditation and doing it from your phone even, where it kind of helps to guide you through the meditation. Next slide. So some benefits of practicing mindfulness can improve your attention, focus, and concentration, can reduce your stress and increase your ability to self-soothe when you feel upset, increases your self-awareness and ability to recognize emotions, improves impulse control, increases empathy for yourself and others. So there's a form of kindness in mindfulness. You're being kind not just to yourself in your mind, but also to others. And so mindfulness can help to develop that kindness and kind of that patience with a lot of different situations. Next slide. So mindfulness can improve your mental health. It teaches us to attach labels to thoughts and to detach emotions. So you may recognize, how you're feeling and put a label to it rather than having an immediate reaction. You're experiencing an event and an emotion, but you're not defined by that event or emotion. Thoughts are just thoughts, not facts. It teaches you to be aware, but without any judgments. Mindfulness is the opposite of ruminative thinking, or the tendency to dwell on negative thoughts, which can cause stress and anxiety, stress and depression to persist or return. Next slide. So just wanted to say that, as part of Kelsey-Seybold Clinic, we are a large multi-specialty clinic, but there's a lot of primary care providers with availability. So we're here for you. If you're interested, you can give us a call, and those staff available 24 hours a day to schedule appointments or help out with any questions you may have. Next slide. Questions?
Thank you so much for that wonderful presentation. That was so helpful. I specifically really liked the 4 A's. That's something I'm going to try to start incorporating into my life personally. So we're going to go ahead and open up the floor for any questions that you may have. We are a smaller group today, so I know sometimes it might be hard to get your question typed into the chat quickly enough. So if you would like to unmute yourself to ask your question, you're definitely more than welcome to do that. I will go ahead and kick us off with the first question. And that question is, can you explain a little bit about the difference between stress and anxiety?
Yeah, that's a good question. I actually realized that when I was going through, I was like, I should talk about anxiety as well. So stress is more of like a symptom. Let's say you're having those internal stressors that we talked about, or external work, family, friends, cognitive thoughts. Anxiety is when the stress actually starts to affect different responses. So, for example, generalized anxiety disorder, if you have irritability, which is anger, you can't sleep anymore, trouble with your appetite or your functioning, having trouble focusing at work, or body symptoms, chest pain, neck aches, back aches, stomach aches. So anxiety tends to be when the stress starts to kind of spill over more into your body and functioning, which is like sleep and work and in your work performance, as well as if it starts to affect just kind of how you feel about yourself or others. And so it's kind of a fine line. Definitely a primary care doctor can help to define that, as well as a counselor, a therapist. They can kind of differentiate between if this is just short-term stress or if this is actual anxiety.
And so some of those things that you mentioned that you could do on your own to help with depression, those things could also be applied for helping with anxiety potentially and stress, like exercising.
Yeah, so those activities, that's a good question too. So we get that question a lot about how can, we help ourselves feel better, considering everything that's happened. So for anxiety, this is the same things. Yoga has been shown to be helpful, exercise, pets, also meditation, mindfulness training, faith-based supports as well. So what faith-based supports is it doesn't matter the denomination, but just having that support from either, religious leaders, spiritual leaders, that can help too with mild anxiety and depression. If you are doing all those activities, including like the journaling, the exercise, the meditation, and you still feel like stomach pain, chest pain, or can't sleep, can't function at work, I would recommend speaking to your doctor at that time, just to see if more treatment is needed, or, if they need to refer to a counselor.
Okay, awesome. That actually answered the next question that I was going to ask, which was, when is the proper time to seek mental health help? So if some of those things aren't going away.
Right. Yeah. If you're noticing that like you're still not sleeping, not eating, or stress eating, having trouble at work or at home or with family members, arguments, irritability, can't focus, or your work performance starts to decline, or the suicidal thoughts from the depression, definitely reach out and speak to a trusted healthcare professional, and they can kind of help navigate, different resources.
Great. So my next question is, a lot of us may know people who have been struggling with their mental health, especially in the last year. But there are many communities and individuals that are afraid to seek professional help. So are there any ways that we can help someone who maybe doesn't want to seek professional help?
Yeah, it's a very good question. If somebody is a family member or trusted, loved one is not wanting to get help, letting them know, kind of like listening and letting them know that you do care a lot about them. You're just thinking that seeing a provider would be a good start. A lot of times, just being there and being supportive, they might warm up to at least a dialogue or a conversation. And then, after some more times of meeting that person, maybe they will be, okay, I should go see a primary care provider. I would definitely not be like a forceful. I know sometimes with children and adolescents, teenagers, there's kind of that, you will go and see the provider. But with an adult, you kind of have to slowly, build your way, and kind of show that you care about them and that you do want them to get better. Another thing is, I'll talk about primary care providers, because sometimes if you, were to say, hey, you need to see a psychiatrist or psychologist, unfortunately, in some minorities, there is that stigma against, mental health or seeing a psychiatrist or psychologist. So primary care provider is a good, entry point, and then they may, after meeting with them, say, okay, I'm agreeable to getting more help.
Thank you. So we have a question in the chat. How do you suggest that I respond and not react to a person who is using me as a scapegoat on her ineptness? What defense mechanism can I use to avoid this person causing me stress?
Okay, so very good question. How do you respond and not react? So with the mindfulness and the meditation, you will have to practice it, I guess, when times are calm. So when you're away from the person, and then when you have some sessions of meditation and some experience with the mindfulness, it will help you kind of remove the emotion from the situation. That means if that person is coming at you, maybe finding a way to get out of the situation, redirect their anger. Maybe that person needs to redirect their scapegoating to the primary care provider to see a therapist. Counseling can kind of help with that too. A lot of times when you go to see a counselor, it's not about, just how you're feeling, but about the relationships you have in your life. So if there is the scapegoating going on by like a family member or someone you have to encounter every day, the therapist may be able to help you navigate and get yourself out of that situation, or to redirect that person's anger, or to correct that person who's scapegoating. So I would recommend seeing, also considering maybe like an interpersonal therapy with that person.
Yeah, that was a really great question in the chat. We had someone raise their hand. Isabel, if you want to unmute yourself and ask your question.
Yes, hi. Good afternoon. Thank you so much for the information. My question is, you mentioned that the depression is more common in women than in men. I know ladies, we're always doing a lot of things with the kids and work and all that stuff, but and maybe we don't see it as much with the men. What is going on with the men that they don't get that much the symptoms of depression as women?
Well, it could be twofold. The depression has a lot of different components. So it can be genetic, but it can also be your environment. When you were growing up, different experiences, things that may have happened. Unfortunately, there is, the United States, there can be things in childhood, whether if it's moves, divorce, any sort of abuse history, that can predispose one to anxiety and depression. And it may also be that men are less likely to get help. So whenever, they're doing these surveys, they do survey men and women, equally, but men are more likely to, I guess, they may not get help, or they might not, answer the surveys. But usually for women, it could be in the 30s, 30 to 35%. And then men, it was about 15 to 20%. But this was all before COVID, so the pandemic. So with the pandemic, I'm sure it would be a different answer.
Thank you. I was like, why they don't get that? Thank you.
Yeah, hopefully that helps. Yeah, but there's a variety of factors, some genetic, but then also it can be the environmental factors as well. And you do bring up a good point, ma'am, that sometimes with depression, anxiety, we get so busy with work and with children and grandchildren that it kind of gets put on the back burner, or, not necessarily treated, because it's so busy with the children and grandchildren and families. And so it's important that you do take time for yourself. We tell everyone, whether it be mother, father, whomever, that they get help for just to take time for themselves and see a professional, if they're concerned about how they're feeling or how they're sleeping, focus, concentration, those kinds of things.
Thank you.
That was a great question. So the next question that I have is it a good idea to tell friends, family members, employers, or colleagues if I have been diagnosed with a mental health condition?
So it's a good question. I would definitely discuss with maybe the provider who had either treated you or talked about the diagnosis, about how to disclose it. It depends on your relationship. A lot of people do tell their loved ones, whether it be a partner or a parent or a child. But at the same time, it would depend on your family structure. So if your family word would get around, to all the aunts, uncles, cousins, nephews, then it might be worth it to just have one adult, or maybe just between you and the doctor. But I would definitely talk about who would be treating you. Now, in terms of your employer, if you are needing to take time for appointments or needing to go through employee assistance program, I would definitely talk to the human resources about it. That way you're making sure you're getting time to get the treatment and you're getting your therapy sessions. Employers can't really use that against you. It can't be like diabetes or pregnancy. And if somebody is trying to use anxiety or depression against you, I would definitely talk to someone in administration or human resources, because it is a medical condition. So it's the same as, you can't really be just, have certain things against you if you're pregnant or you have diabetes. So I would definitely speak with human resources if you have any concerns about things at work.
Thank you. So the next question that I have for you is, have you ever used any of the apps for meditation or mindfulness that you mentioned? There are so many that I come across, and I never really know, how well they really work. I guess I could try them out, but I just didn't know if you'd ever personally used any, or of people who like a certain app more than others.
Yeah, no, that's a very good question. Usually I try not to say the names of the apps because I'm like completely independent from them. But ones that we've had good experience with is Calm, Headspace, and Pray. And so Calm is a United States-based one. Headspace is UK-based, so it has like a British voice. And Pray is one that has more of a religious background. So if wanting to come from a spiritual angle or meditate, more along the spiritual lines, then Pray would be that one. But most of these apps, whether it be the Calm or Headspace or Pray, have a free version and a paid version. So we recommend doing the free version in the beginning. And then if you're liking the way it's going, then you can go out and get the subscription. But definitely do the free version. And then on YouTube, there is a free meditation you can do. Jason Stevenson is his name. So on YouTube, if you just type in guided meditation and Jason, it will be one of the first links. But there's even free ones that you can do on YouTube if not wanting to use one of the apps.
Okay, so I am writing these down. Thank you so much. So I am coming up on my final question. So if anyone has any other questions that they want to get in before we close out today, definitely put those in the chat or raise your hand and I can call on you to unmute yourself. But one question that I like to ask each of our presenters is if you could give us all here one final piece of advice or one thing that you really want us to take away from this presentation today, what would that be?
Probably the one thing I would want to give, to everyone who attended, and I appreciate all of y'all's time and attention, is that, the way we feel or the way we felt these last 14 months, it's all completely appropriate. It's kind of been one of those kinds of years, over the last 14 months. So if you are feeling a certain way, there shouldn't be any guilt or shame in the way you're feeling, because anyone who's kind of been through, the last 14 months has had some change in the way they feel or they think about things. So there's a lot of resources out there in the community and in the healthcare industry and in society. So definitely reach out and let a trusted adult know if you're feeling, like anything is still persisting. I know now, especially with the vaccinations, and that's another thing, make sure you're doing things to stay safe. But as time opens back up, you might feel some uneasiness with like going to the store again or going to church or going on a flight. So just go at your own pace and go within your comfort level, as things slowly start to reopen.
Awesome. Thank you so much. That was a wonderful presentation. I just have a few slides here to close us out. If you're like me and you walk away and like a day later, you think of a really great question, you can always email us at healtheducator@thewomensfund.org if something pops up, maybe later this evening or even next week. At any point, if you have questions, you can reach out to us. I've provided the survey link here on the screen as well as a QR code, but I will also include that in the follow-up email that I send. So we would really appreciate if you would take this survey, let us know what you liked about today's presentation, things that we could do better. Also, if you're interested in any other specific topics, please let us know. As far as what we have coming up for the month of May, we are focusing on mental health. So we have a presentation over stress and coping tomorrow, anxiety and mood disorders on the 21st, self-care on the 26th, and then we have our final mental health awareness series presentation with someone from the Menninger Clinic over the mental impact of COVID on teens next Wednesday from 2 to 3. So if you're interested in any of these presentations, please visit our website and register. I've also included our social media pages. You can follow those as well to see when we have upcoming events. And I want to thank you all so much. Dr. Patel, thank you for taking time out of your day to share this knowledge with us. We really appreciate it.
No problem. Thank you so much. Bye-bye.
Thank you.
You're welcome.